came to Mission because I truly felt like the pharmacists here and everybody that's part of the staff really enjoys what they do. They're passionate about helping patients, and I felt like I could learn so much from them. It just felt like such a perfect fit for me.
I came to Mission because when I interviewed, I met so many great preceptors and pharmacists who were really passionate about caring for their patients and really excellent at what they did. I knew that I could learn a lot from them.
I chose Mission because I really liked the longitudinal experiences. There was a lot of ambulatory care programs I was looking at, and a lot of them were very rotational based, similar to how your P4 year is, where you have 1 month on different rotations. This time, every day is a little bit different, but you get to see your patients longitudinally throughout the whole year, and that's what really drew me to Mission. My favorite part of residency is how many after work things I get to see my preceptor.
Seeing myself grow closer with everyone here.
I love the longitudinal nature of our rotations in the ambulatory care residency.
Just talk about patients or meet up and discuss leadership activities.
Especially my co-residents, I think they've gotten me through so many tough days.
I get to see the same patients over and over for follow-up as often as I need to, and I really love building relationships with them over time.
And it's just a good way to kind of get to know the people that you're working with.
They really pushed me to be the best pharmacist in person that I could be.
Something that I couldn't tell from mid-year or the website or even fully from interviews was the atmosphere of joy and excellence and passion that everybody here brings to their work.
How extensive our medication assistance pharmacy and practice goes.
Mission has a medication assistance pharmacy which helps patients enroll in prescription assistance programs.
It's friendly, it is compassionate. I feel like my coworkers care about me and they care about our patients.
And it's not just our MAP pharmacy, but also at our other outpatient clinical pharmacy services.
And I always thought I would be working with them, but not doing it myself. But really, I do medication assistance every day in a different light and a different piece.
And I felt that in the interview, but not as strongly as when I got here and really was in it all the time.
So it really just seems like all the pharmacists are working together to make sure that our patients are able to get their medications.
So I feel like incoming applicants should really get an appreciation for medication assistance in this program, which is an awesome piece to have as a pharmacist.
The preceptors here are excellent. They're amazing.
My interactions with clinical preceptors are honestly amazing.
My clinical preceptors are awesome. There's a pharmacist in just about every clinic I'm in except my primary care clinic where I am the sole pharmacist on site.
I feel like they care about me as a person. They check in on me even if they don't have to.
They're so passionate about what they do, and they're such great teachers, and they've made me feel so comfortable to step into this role as a resident and as a pharmacist.
And my preceptors are my providers, which I have my clinical pharmacist practitioner license with, and they're always very approachable. They're grateful that I'm there.
And they're also really wonderful at their job, and I feel like I can learn so much from them. And they have been very helpful and vocal in their feedback and telling me ways that I have grown and ways that I can continue to grow, and that feedback is really valuable.
Because the transition from a student to a resident is a little tough at first, but I feel like my preceptors have just kind of put me in the right places to learn the right things and to just be more confident. I can definitely say I feel more confident now than I was when I first got here.
But also how easy it is to learn from really excellent preceptors who are willing to invest time and effort in you as a learner and as a pharmacist.
My free time, I tend to spend a lot of time with my co-residents and any friends that come visit Asheville.
But my personal thing is going to all the coffee shops and trying all the hot chocolates.
I like to walk my dogs. There's lots of great parks and trails.
There's lots of things to do in Asheville, from eating.
I'm trying to figure out which one's my favorite. I'm coming up with a list, kind of ranking it.
And I also like to go to lots of different restaurants.
My thing is trying all the hot chocolate around town, especially in this beautiful weather.
Biltmore and just checking out all the different breweries.
If I had one word to describe Mission, it would be compassionate.
Mission is caring.
Mission is variety.